How's it going, everyone? Welcome back to another PT Pro from the Optimal Body Podcast. I'm Dr. Dom.
And I'm DocJen.
And today we're going to bring you some info on groin injury or groin pain. So this area kind of up in our pubic area on the inside of our legs, talking about those adductors a little bit. So stay tuned if you've ever had groin pain, and we might help you sift through that a little bit. Yeah, so when we talk about groin injury or groin pain, the thing is, like we've talked about with the pelvis before, there are so many things that attach in that area or make up the pelvis or make up the groin. And one of the primary muscles is the adductor. That's kind of just the inner thigh. That's the big bulk of muscle that makes up the inside of the thigh. And there's actually a lot of different muscles that are adductors or help add the leg back to the center. And one reason I think the adductor is pivotal to talk about is it actually helps, yes, add the leg back to the center. But it's unique where when our leg is flexed forward or pulled in front of our body, it helps extend the leg back to neutral. Or when it's extended back behind our body, it helps flex a little bit forward. And even based on where it's attached, there are some rotational components to how it controls. So all of the movements of the hip tug and pull at the adductor or make it work.
Exactly. And then when we're talking about the groin, remember, we're just going to be talking about every muscle that incorporates into the pelvis down there. So that's even your abs, like your abdominal wall, it comes down and attaches down into that pubic bone right at the base. And then, exactly like Dom said, the way that the adductors kind of work with the flexors, with the extensors, they play a role in all of that as well. And we just need to take in account of everything that kind of plays a role down into that groin region and why there are 9 different types of injuries we're going to go over today.
So an adductor strain. And we can have any different degree of strain, whether it's just a slight strain where we tugged on that muscle too hard, or if there's actually a little bit of a tear where some fibers have torn. So the pain can be of a different degree and the length of recovery can be to a different degree. But that's generally going to be right on that adductor tendon up near the pubic bone.
Yeah, exactly. So I think it's more muscular, it's more tendinous. We're going to talk about obviously different ways to be able to work through that, but it's like a muscle pull.
And this will happen often in younger people that have a little more malleable bone where their tendons and their muscles are strong. And when we pull really hard, we might actually chip a little bit of that bone off. The tendon's not going to tear at all, but the bone comes off of that pubic area, and that's going to be more that avulsion fracture. That's like a really intense strain that the muscle doesn't actually get hurt. It just pulls so hard that it pops a little chunk of bone off, and then we have this avulsion fracture of the bone.
So that's more of like that acute type of injury. Something traumatic kind of happens, and you definitely know right away.
Yeah, you're going to know that something happened there. And then depending on the severity, you might have some weakness. It actually might be a little weaker than the other side, or depending on what muscles were involved specifically. So those are ones that more so involve the adductor muscle and the bone where that attaches in specifically.
And then talking into the bone again, we can get different stress fractures that happen around the bone. Mm-hmm. So whether that is up into, so the big bone that's right in our thigh is our femur, and right at the head of the femur at the top where it connects into that pelvis, we can get some stress fractures right at that femoral head as it connects into that hip. We can also get some stress fractures around the pelvis. And so this is a little bit more annoying to have to work through. Bone pain is just super uncomfortable. It's like a bone bruise. It happens for quite a while. Like walking on stress fractures in your feet, not fun. Also, we use our hips for just about everything that we do, or we want to be using our hip hinge. Totally. So it's a little bit more of a work through and a rehabilitation program that's going to take some time.
It's kind of similar to one that is down the list a little bit, but like FAI, where we start getting bone modeling. And we had a whole episode on FAI, which is femoral acetabular impingement. It can also happen on the femoral neck, very similarly, where we're just getting a lot of activation in the front of that hip, or we're overusing the front of that hip, and we get some rubbing of our hip bone or our acetabulum on that femoral neck. And we have a whole episode that kind of teases into the specifics of that. But just again, putting too much pressure on the front of those bony structures. A lot of people with hip impingement will take their hand like this, like a C, and they'll put their pointer and ring finger like right into the groin with their thumb kind of on the outside of their hip and say, this is where my pain is, or pointing right to the inside of the hips. That's indicative of an FAI type injury, which also comes with different labral issues a lot.
Right where your pubic bone, so think of, again, that pelvis, we have our pubis symphysis, which comes in right in the front of that pelvis area. And it's called the pubis symphysis, and it kind of comes together. Sometimes get a lot of irritations here. We can build chronic inflammation here because if we're thinking side to side movement or one area moving more than the other, dominate, whatever it may be. A lot of times as therapists or chiropractors will check for alignment issues, like, is one higher than the other? How are they responding together? And over time that can cause some inflammation right into that area. A lot of runners, dancers, soccer players, a lot of people who do, almost any sport I feel like can get some of the irritation there.
And that can happen on an acute stage. So you do a workout and I've never felt this before. My pubic area is inflamed. That is more of just a pubic myalgia or a pubalgia versus something that starts happening weekly and then a couple times a week, and then we're just kind of get this chronic dull aching. That is more of this ostesis pubis or ostesis pubis, which basically means relating to the pubic bone, but that means more of this chronic inflammation is when we call it the ostesis pubis.
Right.
So those are just a couple other differentials or diagnoses that people might throw out there when we're having groin pain. One of the ones that you might not see as often, because it might have to do more with people who are pediatric, which means they're below 18 usually, or they still haven't gone fully through puberty. That means that sometimes these areas on our bone called our epiphyseal plates are not completely fused, and that's just a fancy term for your growth plate.
Yeah.
So our growth plates are still active. They may be a little more malleable, and if we're doing a lot of repetitive explosive exercise or power stuff or landing from jumping a lot, we might put too much pressure in those epiphyseal areas and get an epiphyseal injury or a growth plate injury.
One that is super common, especially me as a former Pilates instructor, used to see all the time. And it's still something that's super common. I'm asked about, which I posted about, guys. This is snapping hip syndrome, which I feel like we could do a whole nother podcast on really diving into the intricacies and what you can start to do about it. But ultimately, it's not so much a pain that you're having all the time in your hip and groin. It's more of when I'm doing mountain climbers, I notice that my hips are popping or snapping, or if I'm doing ab exercises on my back, which is where it came into play a lot with Pilates. As I'm doing some marching, I'm getting some snapping or some irritation right into that groin area. And so that one becomes really common, and we'll go into different strategies that you can start to be and pay attention to.
How can we start to tease out, where is my issue along all those diagnoses? We have to kind of explore every different range. The first thing we brought up was flexing and extensing. So if I get in a lunge with my irritated leg in the front and just stand up and go into extension with that leg, does that irritate that groin pain? Maybe it might have to do with when we're doing extension, or when I have that leg behind me and pull it forward to flex, is that irritating? Or doing some ab exercises where I'm using a lot of flexion of my legs. Am I supporting through that front line and the lower abdomen in those hip flexors and adductors through the quadriceps at the front of the thighs? So how is that entire front line working? That's going to help you explore some of the issues that were more on the anterior side, like the FAI or the snapping hip or things like that.
Hernia.
Inguinal hernia. That's one that we didn't even bring up, that we can have either inguinal hernia or a sports hernia. I personally had some issues with an inguinal hernia where I just knew I was putting too much pressure to the front. And one of the things I've been working on the most is my core and my low abdomen, and how much that brings back to my ability to flex and round my body, right? I just was doing it too much, probably from my hip flexor, adductor, quad, that complex, and not bringing in enough back to my foundation. So that whole anterior body can help you explore some of those symptoms or diagnoses that might happen more on the front side of the body.
In order to simplify it, what I like to say is you're either neglecting something. You might not be even strengthening your adductors. You might not be aware. You might not be aware of your pelvic floor. You might not be aware of your breath as you're doing mountain climbers or ab exercises. And when we're neglecting something, then we're only using one part of the system. And in reality, every single step that we move, guys, it gets a little overwhelming, but we really are integrative beings. We use everything, and we have to start to explore this awareness of our body, of how our breath plays a role with our muscles, of how our breath plays a role with our pressure system from our pelvic floor to our back to our front, and how then that is going to change the way that we're extending that hip with the glutes and how it's flexing with the hip flexors. Like, it all plays a role. And of course, I can't neglect to bring up mobility. And that's something that I find a lot actually when people have rotational issues in the hip, really tight, especially don't go a lot into hip internal rotation. So if you're thinking about it, it's like if you're laying down and you kind of grab the top of your thigh and then you rotate the foot outward. Ooh, mine's a little tight right now.
Yeah, so you're almost like windshield wiping your leg to the side just to see, okay, and I can't internally rotate with a darn, but I
without moving your hips a lot and compensating. Yeah, exactly.
Look at that, I got so much. So doing that, but then on the flip side, can you rotate inward into that external rotation and just experiencing
your adductor? So it's having that range of motion. So I say that too because a lot of times when people are neglecting that hip internal rotation, we're actually really tight in those adductors and they're holding you back, and they're saying, no, we don't have enough range to actually feel functional going there, so we're just going to stop you. If we start to think about these things, am I tight? We need about 30 degrees of functional hip abduction. Okay, so coming out to the side, meaning the stretch of those inner thighs. And that's without, again, those hips shifting or anything.
But a lot of people might not even have that.
Exactly.
They might not even be aware because they'll lift their leg to the side, be like, I have plenty of range. But move those legs, move that adductor, get it lengthening and see what it feels like in the body.
Yeah, and I'll show different examples as we're talking through this on YouTube, to show some of my favorites, adductor rocks and types of butterfly type things. I don't necessarily like butterfly, but opening it up a little bit more. I'll show different
laying on
things.
your back and legs against the wall and then letting them slowly relax to the side. It's just similar to what we're looking to get in the butterfly, but I think it does it a lot better. One of the studies that we looked at that I think is just good to point out, and I don't care really about the specifics of the study, but the principle was okay, people with groin pain did this one adductor exercise just to activate the adductor itself, basically. And about 41% of people saw immediately a significant decrease in their pain. Great. It's called the Copenhagen plank or the Copenhagen adductor plank or something like that. And it's basically just a side plank where you're using your adductor rather than the outside of your hip to hold your body up. And it basically just illustrates to me that all they did was activate it, speak into that adductor just a little bit, and they had relief in their pain in a short term. So what if we did something like that consistently every day?
Think about it.
What kind of message would that type into our system?
We're bringing stimulation and awareness back to this area that's saying we can lengthen, and that's okay. That's safe for my body to do. And I can stimulate, activate, and strengthen in a functional manner. And especially if we're talking about adductor type movements, it's going to be, again, effective on walking, running, going forward and backwards, but also side to side movements.
All you do if you want to explore activating that adductor yourself is get a chair, and like you're going to be in a side plank, just put your top leg up on that chair, up on whatever it is, a couch, a chair. You might need to have a place to put your leg underneath, or you can just bend your bottom leg.
Yeah.
But then basically all you do is lift the bottom leg off the ground and keep yourself in that solid side plank with that top leg pressing down into the chair or the couch or whatever.
If you've never done it, it is tough. So start with your knees bent and start with your knee on the bench or the chair or whatever.
Yeah.
And then work it's just going to shorten that lever and that force of that adductor having to work. And then if we go out toward the shin and then toward the ankle is obviously going to be the hardest.
Yeah. And getting up on a hand and then putting your other, there's all sorts of things you could do at that level to make it tougher. But as the study illustrated, just start activating that thing and you might very well feel a difference in your groin pain today.
Thanks so much for joining us for another PT Pearl. Now, if you are interested in continuing to explore your body, you must check out the Grateful for My Body Challenge that's happening now. So right now, November 1st through November 30th, we are doing a challenge that's really going to take you into all these different things, the breath, the core, the strength, the mobility, all of it that we talk about all the time. So I'll leave the link in the description below. Go check it out and join us, because this is the first time we're doing it. Not sure we're going to do it a lot again. So comment below, let us know what you think, move into the different things, explore your body, and make sure you subscribe so you don't miss out on future ones.